No, that's great. And I know there's been a lot of talks lately that I've been encountering, in the space of home dialysis and especially home hemo to consider just restricting barriers to access. So even intravenous catheter for home hemodialysis and being, proactive in something like that is another access for home hemodialysis.
Oh, like
Um,
using the catheter itself, you're saying, right?
Right, right. So that was interesting as well. Just coming off of some of the clinicals and the discussion, Dr. El Shami was actually discussing that is another option. I know there's different schools of thought, and again, I'm not a clinician by any means, but hearing
Mm.
to your point, the biases or the conversations about if home dialysis is the way to go, and we know that, how do we almost reverse engineer some of the barriers that are preventing some of that? And I didn't know if you had any perspective on that, but I thought that's interesting because I think the end goal again is just expanding access and efficacy for treatment for patients.
Yeah, so like I said before, there was this thing about fistula first for the longest time, get the fistula in the arm, and then it became a thing called catheter last, right? And meaning you can get a graft in their arm. And
Hmm.
so, the thing is, the problems with catheters are they can get infected. They can also lead to occlusion of that vein. So as that access that catheter sits in your chest, the vein actually collapses around it. But simultaneously, if the patient is 75 years old and you're starting dialysis, you're not looking at the long run. Do you see what I'm saying? You're looking in the short run. So I think sometimes you have to hone in medicine or hone in your techniques very per patient, right? So, I'm actually not opposed to that 75-year-old not getting an access in the arm and just having a catheter. You know what I'm saying? Like I don't see, if that makes that life so much better for that patient and it's easier for them and they can actually access it, or I'm not opposed to it in certain scenarios at all. So I think maybe you should individualize the treatment as needed per patient. Now, in that 40-year-old, I probably wouldn't agree to that. Do you see what I'm saying? But in the
Hmm.
elderly population, where we know the horizon is not as long, right? Like, let's
Hmm.
just be honest, they're not going to live 10, 15 years. They're probably going to live 2, 3, 4, 5 years, right? Somewhere around there. So if it makes them that much better that they're not getting poked and just using a catheter, I don't have a problem with that. But the inherent problem is the dialysis units all measured by their like floppy meetings, like they have 90-day catheter rates that they have to
Hmm.
take account that can kind of dig them. Do you see what I'm saying? So
Okay.
like the dialysis units typically have 90-day catheter rates. So if they have a catheter for more than 90 days, it's considered a bad metric on their metrics. So.
Interesting. Interesting.